help you? We're here for our 10:30 appointment.
What is your last name?
Hunter.
Hunter. There you are. Just have a seat and the nurse will be right with you.
Okay, thank you.
Mr. and Mrs. Hunter? Hello.
Hello.
How are you today?
I'm good.
Okay, we're going to go right in this first room here. Yeah, you come on in, have a seat, and you can have a seat right up here. Okay. What brings you to the office today?
We have some questions. I was talking to a friend of mine about donating cord blood. She had mentioned it to me, and we had wrote down some questions for you.
Okay. What kind of questions do you
Well,
have?
first of all, we want to know what is cord blood.
Well, cord blood is the blood remaining in your child's umbilical cord and following the birth. And it's a rich source of stem cells that can be collected at that time. Do you have any other, what other kind of questions do you have? Because I'm gonna probably go get the nurse and have the nurse come in and help, because I'm a nursing student, so I want her to kind of come in and explain a little bit more to you. She might know a little bit more than what I do about this, okay?
Okay.
All right.
Hi, Sherry. Who do we
Hi.
have here today?
We have Mr. and Mrs. Hunter, and they're here with some questions about cord blood and cord blood collection.
Okay.
All right?
Hi, I'm Deanna. I'm with you guys today. How are you?
Good. How are you?
Good. Okay. Well, Sherry informed me that you guys had some questions about cord blood.
Mm-hmm.
Okay.
Yeah, we want to know what are stem cells?
Okay. Well, what I know about it is they're building blocks of our blood and immune systems. They're found throughout the body, including your bone marrow, cord blood, and peripheral blood. They are particularly powerful because they have the ability to treat, repair, and or replace damaged cells in the body. What else do you have questions
We
about?
would like to know when the cord blood would be collected.
Okay, that is at the time right after delivery. And it's actually real precise. It's right after delivery. They clamp the cord, they take the blood, and then it goes and gets processed right away at birth.
So by donating the cord blood, would that change my delivery experience at all?
No, it will not. Your delivery, all the focus is going to be you and the baby. No blood is taken from your baby, only from the cord and the placenta after the baby's born. And a technician will come in and do that. You'll still have a nurse helping you, and we'll still have a nurse helping the baby. So you're not going to notice any differences or any changes.
Is my wife and baby at risk during this procedure?
No, they're not. This is a no risk in your child during the cord blood collection process. The baby does not remain in the birthing area during the procedure, which is painless and non-invasive. So, no.
Will this cost us anything?
Okay, there's no cost to you if you decide to donate in the public bank, which is open to everybody. If you decide to do private, that is an extra expense. It's actually all on you, but at the end it also remains that this is your cord blood and nobody else can get it. So that's something that you guys can talk through. If you decide to go further into it, then we can talk about the financial situation of it. So there's two options. Shoot, you guys.
Okay, do we have any other questions? Any other questions?
What will
Okay.
happen to our child's cord blood if we donate it?
Okay, if the family decides to donate a baby's cord blood, and there is a cord blood bank in this area, the mother will need to obtain a collection kit that may include a family medical history questionnaire, a consent form, and the collections material. The hospitals are not responsible for those. That is somewhat private. The informed consent must be signed prior to the onset of active labor and before the cord blood collection. The consent must contain information pertaining to what tests are to be performed on the cord blood and how the parents will be informed should the test results be abnormal. Once a baby's cord blood is collected, it is typed, screened for infection diseases and for hereditary hematologic diseases. If the donation is large enough and meets all of the required standards, it will be cryogenically stored for potential transplantation if a match is found, or it might be used for quality improvement in research.
And how does donated cord blood help others?
Okay, it can help treat diseases such as malignancies, bone marrow failure, hemoglobinopathies, immunodeficiencies, and/or inborn errors of metabolism. I know it's a lot for you guys to take in. It's a lot for me to explain to you.
And how soon should we notify the cord blood bank?
If you decide that this is something you might want to do. Okay, they should be notified approximately 4 to 6 weeks before the due date or about week 34 of pregnancy. I can give you a website for the cord blood banks in your area, private and public, and we can help you to make a decision and contact one of your choices if you decide to do either of these.
Is there anything we should bring when my wife gets ready to deliver to the hospital with us?
When you enroll, and that's wherever you decide to choose, whichever you decide to choose, the cord blood bank will provide you with a sterile saving kit. You supply it with, you simply carry it with you to the hospital. The method of collecting the cord blood is extremely simple, and any doctor or midwife will be able to collect. Did I just do that wrong? Collect it. Elaborate instructions are provided, and a 24/7 helpline is available should it ever be required.
Okay. And if it turns out like our child is going to need cord blood, can we retrieve the cord blood that we donate for their use?
Depends on how they collect it, or how you're going to store it. If you're going to store it at a bank, or if you're going to give it to at a public bank, that would
Right.
depend.
Okay, so if we privately donate it, then
That's where the
That's where
financial comes into. If you're willing to pay upfront what it costs, and then there's like a yearly fee. If you're willing and you are able to do that, then it's considered yours. Otherwise, you're just donating for the public
okay.
and for research purposes.
And then I had another question. Our neighbor is African American and she's pregnant. Is this something only for Caucasians, or could I give her some information about this
Sure.
as well?
For a successful transplant, the tissue type of bone marrow donor or a cord blood unit needs to match the patient's as closely as possible. Tissue types are inherited, so patients are more likely to match someone who shares their racial or ethnic heritage. And patients from racially or ethnically diverse communities can have a harder time finding a match. So anyone can donate, but it's kind of how the person matches up is what's different. But yeah, so anybody can donate their cord blood.
No matter what culture they're from.
Other research we have, more than 40% of minority patients who received a transplant used cord blood. African Americans are more likely to suffer from sickle cell disease and at present are on a homeopoietic stem cell transplant. And if you guys wanted to go further into it, many more patients could be helped if cord blood is donated, especially from these communities. So kind of answering your question about your neighbor, Black and African Americans, American Indian and Alaska Natives, Asian, Native Hawaiian and or Pacific Islander, Hispanic, and Latino.
Do you have any more questions?
No, I think me and Kool-Aid here have a lot to discuss about this. So I appreciate your time.
All right.
Okay.
Well, no hurry, and before you leave, I'll make sure Sherry gives you some pamphlets. It's the information that we have. We don't do it here. We just offer it, and like I said, when you're ready to deliver, bring in your kit if you decide to go that route. And good luck with everything.
Thank you for
All right, thank
answering
you.
our questions.
Okay, here's some
Thank you.
pamphlets, okay?
We have
And
a lot
thank
to
you.
think about.
Yeah.
Okay.
Appreciate it.
I need a pen.
Leave the door closed and then open it.
Okay, so what do you guys think about the cord blood thing?
Oh my gosh! Oh my gosh, baby!
That's one way to get cord blood.
Oh yeah, oh yeah,
Dance.
oh yeah. Come on. Daddy's making a movie over there. Doesn't he look funny?
You gonna sing a song?
Oh yeah.
Or are you gonna pick your nose?
Somebody out there?
Lunchbox, no, I guess it's soda and a jacket.
Do you need the stethoscope to hear if somebody's out there?
Yeah.
Here. Let's put the stethoscope on to see if somebody's out there. You can hear. Ready? Do you hear? There's somebody out there? Yeah, there's somebody out there.
Well, your school teaches a lot of, gives you lots of good information about all those things out there.
With the
Sherry.
cord blood.
Yeah.
I've been learning about it in my textbook.
Okay, I guess you guys won't be going anywhere.
Okay, so cut it, and then we'll have to get them going out.
Are you there?
Deanna, do you
I
have-
don't have the keys for this. Our patients are in their
Finally, you got the door open.
We need to move this stuff back out there.
Well, at first you're scared.
Are we ready to start?
Yeah, Dee's called for you.
These who?
Dee's nuts. I'm sure Barb will like that one.
I don't think it'll stay.
Just go ahead and shut it.